Good afternoon, everybody. Dr. Arjmand, Head and Director of the Trophy and Regenerative Medicine Research Center at Tehran University of Medical Sciences. At first, I would like to thank Professor Ardal and his team for arranging this valuable event. In this session, I'll try to talk briefly about co-transplantation of human fetal mesenchymal hematopoietic stem cells for treatment of type 1 diabetes in mouse model. As you can see here, and you know, diabetes mellitus has a huge burden on all of the healthcare systems, and in type 1 diabetes, we have an autoimmune disease and metabolic disorder following destruction of pancreatic beta cells, insulitis, and some inflammation and inflammatory factors that are released in the body and in the blood. And based on this theory, you can think about the modulation of this immune system using different kinds of treatments, for example, medications, routine medications, and recently using stem cells. As you know, stem cells can retrieve from different sources, adult, embryonic, and also fetal stem cells. And stem cell can be used by using different routes, for example, intravenous, intraarterial, and intrapancreas in diabetes. And also you can use different kinds of stem cells as co-culture or co-transplantation for increasing the outcomes and to achieve best outcomes. Scientists can use different techniques of imaging to track stem cells and follow their homing and engraftments. In this study, our objective was that using to evaluate therapeutic effects of different types of stem cells in treatment of type 1 diabetes, and evaluation the effect of co-transplantation of fetal hematopoietic stem cells and mesenchymal stem cell on their engraftment, and also the effect of co-transplantation of these two types of cells on therapeutic effects and benefits, and also for monitoring of cell engraftment. We use GFP labeling of mesenchymal stem cells in this study, and we compared two route of transplantation, intravenous and intrapancreatic injection of stem cells, and we compared these two route of transplantation in our outcome measures. Hematopoietic stem cells have been used in different studies, and we can find some positive results in treatment of different diseases, also in type 1 diabetes using hematopoietic stem cells. And some experimental studies have introduced and have shown that co-transplantation of mesenchymal stem cell and also hematopoietic stem cells can increase their outcome and their benefits in treatment of diseases, also in type 1 diabetes. Mesenchymal stem cells have increasingly used as the most common cells in cellular therapy. They can be found and retrieved from different tissues in the body, such as bone marrow as the most common, and also adipose-derived stem cell or perinatal tissues, and also fetal tissues. We can retrieve the mesenchymal stem cell and use them for cellular therapy. Additionally, you can see in this slide that mesenchymal stem cells secrete some types of modulatory factors and used for immunomodulation in different autoimmune diseases such as type 1 diabetes. And in many studies demonstrated the treatment of type 1 diabetes as reversing hyperglycemia, such as the study of Yaoshit and its colleagues. But fetal stem cells, fetal source, has some advantages in comparison with adult sources. For example, higher homing and engraftment potency, higher potential of renewal and engraftment, greater multipotency, in some cases pluripotency properties, and they have lower immunogenicity and lower tumorigenicity. Many tissue and organs of fetal can be used for retrieve of stem cells, such as liver, bone marrow, lung, spleen, and other types of tissues. Fetal mesenchymal stem cell cannot express HLA class 2, and this is used as an advantageous to avoid from the immune rejection, and also they have not any alloreaction or increase reactions in the lymphocyte proliferation, can decrease them, and also they can use for some different allo or xenotransplantation without any rejection. In this study you can see here, after getting informed consent from the fetus donors, legally aborted fetus retrieved and transported to our cleanroom facility, and the liver, lung, or other tissues can be retrieved. And in this study, we used liver, mesenchymal as fetal and fetal stem cell. After that, after retrieval and culture, GFP labeling was done, and then transplantation was performed. For starting this study, we get approval from our ethical committee in Endocrinology and Metabolism Research Institute, and using all of the restricted guidelines for animal ethics, and also using restricted guidelines for informed consent from our fetus donors. Legally aborted fetus were used from 6 to 12 weeks of gestational age. Informed consent according to the Therapeutic Abortion Act in Iran were obtained from the parents of the legally aborted fetus. Additionally, medical history and physical examination of the mother for screening of different probable diseases were done. Serological tests such as HPV, HCV, HIV, HTLV, and syphilis were performed for screening and quality control of our products, cell products. And fetus transferred to our CGMP facility, cleanroom facility, for retrieval of liver and culture of the mesenchymal and isolation of the hematopoietic stem cells. As you can see in this diagram, just 2% of our donated fetuses were eligible for our processing. Others were discarded because of different guidelines and exclusion criteria. Discarded. Just 2% of them were used from PROM, premature rupture of membrane, and fetal disorders, maternal diseases, ectopic pregnancy, bleeding, and induced abortion were used for this study. And fetal liver were processed in our cleanroom facility, and hematopoietic and mesenchymal stem cells were isolated and cultured. And then isolation of mononuclear cells, and then culture of mesenchymal stem cell as a routine protocol. And also after that, we used from second or third subcultures, use them for cryopreservation, karyotyping, and using for characterization. After this stage, all cells were characterized using flow cytometric analysis for evaluation of their CD markers and HLA-DR, cell cycle analysis, and differentiation potential, adipogenic, osteogenic, chondrogenic, based on the routine standards, and cytogenetic evaluation were done. Also RT-PCR for evaluation of them, some pluripotent factors such as NANOG, REX1, SOX2, OPT4. After isolation and performing some quality control and characterization methods, mesenchymal stem cells were labeled by using green fluorescent protein for tracking, and also magnetic labeling. Animal ethics guidelines, ethical guidelines were used, and also 3R rule uttered in this study, and also animal housing based on international and national guidelines. You can see here our experimental design. After STZ injection for producing our diabetes models and validation the model, at day 7, hematopoietic or mesenchymal or both of them were transplanted, and during after 1 week, 2 and 3 weeks, blood glucose were evaluated, and also after 35 days animal imaging were done. For induction of type 1 diabetes, we use streptozotocin or STZ in sodium citrate intraperitoneally, and after 7 days we evaluated our models and validated them. Each model with blood glucose more than 250 or 300 selected as diabetes models. We designed our studies and divided our models in 4 groups. Group 1 received mixed suspensions, both types of cells, hematopoietic and also mesenchymal stem cell. Group 2 intravenously. Group 1, Group 2, both of cells intrapancreatically, and Group 3 just mesenchymal stem cell intravenously, and Group 4 negative control. And stem cell transplantation were done around 200,000 cells, hematopoietic stem cell, and 100,000 GFP labeled mesenchymal stem cell for 3 of the groups, except Group 4 as control group. You can see here our surgery on mice and extracting pancreas, and we injected our cells, as you can see here, by small needles in pancreas, all head, tail, and body of the pancreas. And then we sutured our cases and used antibiotics for avoiding the probable inflammation or infections. After that, we used molecular imaging in our live animals to track our cells. You can see here our flow cytometry characterization of our cells. Here, differentiation potential, you can see here, and also karyotyping of our donated fetus cells. You can see here in normal 46 X5 karyotype at 10 passage or subculture. And also we use colony forming unit for more characterization of donated cells. You can see here our GFP labeling and characterization. As you can see in this table, there are not significant differences between group 1 and group 2 that received IV and intraperitoneally, intrapancreatically, hematopoietic and mesenchymal co-transplantation. But in mesenchymal stem cells, just the group 3 that just received intravenously mesenchymal stem cells, there were not any significant differences in at day 56 between their blood glucose, and we had the best results in our co-transplantation groups, group 1 and group 2. You can see these differences in this diagram. Our best results in decreasing the blood glucose were in 2 groups, IV intravenously or intrapancreatically injection of both of our cells, co-transplantation. It shows that we can say that co-transplantation of mesenchymal stem cell and hematopoietic stem cell had significant advantages on using of in comparison with using of the single cells. After injection of our cells and getting some results, we used molecular imaging. You can see here in intravenously injection, most of cells were entrapped in the liver, but in intrapancreatically injection, you can see accumulation of the cells in the pancreas and also liver. Also here you can see positive model and negative model group of model, and also intravenously you can see that most of cells accumulate in the lung, pancreas, and liver. And GFP labeling showed that stem cells can accumulate and engraft in the damaged tissue. In this study, our damaged tissue was pancreas. In discussion, advanced therapies have been introduced as promising treatment. Mesenchymal stem cell as the most common stem cell source has been used for cellular therapy, also for in different diseases, also for in diabetes. Recently, fetal stem cell as a more potent cells and more have more advantages, such as more renewal in comparison with other counterparts, have been introduced. In our study, morphology and phenotypes of our cells, mesenchymal and adult mesenchymal stem cell and fetal stem cell, mesenchymal stem cell were similar. Previous studies demonstrated that fetal stem cells stem cells have some properties of embryonic stem cell. For example, they can express nanog and rex1 and SOX2 as a pluripotent properties of embryonic stem cell, and we can use them as these more potent cells for cellular therapy, and then you can achieve some better results and outcomes. Fetal stem cells have not any immunorejection because they cannot express HLA type 2, and we can use them safely in our allo and xenotransplantation studies and therapies. In our studies, such as some previous ones, we showed that co-transplantation of both types of these cells, mesenchymal and hematopoietic stem cells, have some advantages in our results and the outcome of our treatments. Our concepts was approved in this study and also supported by some basic studies that the xenotransplantation of human mesenchymal stem cell in animals with or without immunosuppression can introduce us some results that mesenchymal stem cell have not any immunorejection properties, and co-transplantation has some significant advantages on using just one single types of cells, for example, just using mesenchymal stem cells. And so we suggest and recommend all scientists as to use mix cocktails of cells more than single types of cells for treatment of different diseases, because results show some advantages in treatment and in outcomes. Between different routes of administration or study didn't show any significant differences between intravenous or intraperitoneal injection. We just found significant differences between co-transplant or single cell transplantation groups, and it was very interesting. And our results showed that GFP-labeled mesenchymal stem cell in intravenously transplantation, most of them were entrapped in the lung, but in injection of intraperitoneally, they engraft in the pancreas that was damaged by using STZ, streptozotocin, and in conclusion, human fetal stem cell, especially from first trimester of gestational age, are invaluable sources for cellular therapy because of their higher pluripotency and higher renewal potency that can affect on our outcome of treatment. And we strongly suggest the co-transplantation of both types of these cells, mesenchymal and hematopoietic stem cells. Our result also revealed that a superior therapeutic effect of co-transplantation, and also the effect of mesenchymal stem cells probably is dose dependent. When you use more count of mesenchymal stem cell for treatment, you can achieve some better results and outcomes. cell imaging can help scientists to track their cells and plan their transplantation methods to achieve some better results and well-guided cell transplantation. Based on this theory, cell imaging can guide cell delivery, optimize our methods and protocols, and increase our desirable results and outcomes. But we should find some non-invasive, safe, and also highly efficient, multimodal, ideal imaging methods for cellular therapy. And finally, again, I suggest our scientist colleagues that try more and more in field of using different kinds of cells as co-culture or co-transplantation in their protocols and clinical trials. Thank you so much and have a good time.